In this episode, we're breaking down everything you need to know about cesarean delivery: what it is, why it's done, how the procedure works, and what recovery looks like. If you're preparing for birth or want clear, simple information, you're in the right place. Let's get started. What is a cesarean delivery? A cesarean delivery is a surgical procedure used to deliver a baby through two incisions, one in the mother's abdomen and another in the uterus. The mother is usually awake under spinal or epidural anesthesia, although general anesthesia may be used in emergency cases. C-sections have become very common worldwide. While sometimes they're medically necessary, they can also be elective in certain situations. Why do doctors recommend a C-section? There are many medical reasons why a C-section may be the safer option for the mother or the baby. Reasons related to the baby. The baby is in a breech or transverse position. The baby is significantly large, making vaginal birth difficult. Signs of fetal distress or lack of oxygen. Abnormal heart rate patterns. Umbilical cord issues, such as cord prolapse. Reasons related to the mother: a small or abnormally shaped pelvis, high blood pressure or preeclampsia, placenta previa, placenta blocking the birth canal, heavy bleeding or medical complications, certain infections or health conditions, emergency reasons during labor, labor not progressing, weak or ineffective contractions, maternal exhaustion, sudden complications threatening the health of mother or baby. Can a C-section be elective? In some countries, yes. A mother may choose a planned C-section for personal or medical reasons. However, doctors emphasize that the decision should be well informed, as vaginal birth has its own natural benefits. What happens before the C-section? Before the surgery, several preparations take place. 1. Medical assessment. Blood pressure check, blood tests, review of medical history, ultrasound assessment. 2. Fasting. Women are usually asked not to eat or drink several hours before the surgery to reduce complications during anesthesia. 3. Hospital preparation. IV line insertion, giving antibiotics, moving the mother into the operating room, choosing the type of anesthesia. 4. Emotional support. Having a partner or family member nearby helps ease anxiety and provides comfort. Types of anesthesia used in C-sections. Spinal or epidural anesthesia, the most common option. The mother stays awake and can hear her baby's first cry. General anesthesia, used only when absolutely necessary, such as during emergencies. The C-section procedure, step by step. 1. Sterilization and draping. The abdomen is cleaned and covered with sterile sheets. 2. Making the incisions. A horizontal incision is usually made in the lower abdomen. A second incision is made in the uterus. 3. Delivering the baby. The doctor gently lifts the baby out. Within seconds, the crying begins, the moment every mother looks forward to. The baby is then checked, cleaned, and handed to the parents if possible. 4. Removing the placenta. The placenta is carefully removed and the uterus is cleaned. 5. Stitching the incision. The uterus, muscle layers, and skin are closed with sutures. The entire procedure typically takes around 30 to 45 minutes. Right after the surgery. After the C-section, the mother is moved to the recovery room where vital signs are monitored, bleeding is checked, the effects of anesthesia are assessed, breastfeeding is encouraged as soon as possible. Pain after a C-section. Pain is normal, especially during the first 48 hours. Doctors provide safe painkillers, including options compatible with breastfeeding. The discomfort gradually decreases in the days following the surgery. How to care for the incision. Proper wound care is essential. Keep the incision area clean and dry. Avoid lifting anything heavy. Wear loose, comfortable clothing. Watch for signs of infection, such as redness or unusual discharge. Follow your doctor's instructions strictly. Moving after the C-section. Although it may feel difficult, gentle movement is encouraged shortly after surgery. Walking improves blood circulation, reduces the risk of blood clots, helps the bowel return to normal. Movement should be slow and careful. Breastfeeding after a C-section. Breastfeeding may feel slightly delayed or challenging at first, but milk production begins normally. Helpful tips. Try comfortable breastfeeding positions, such as the sideline position. Ask for assistance during the first attempts. Keep the baby skin to skin when possible. Can you get pregnant again after a C-section? Absolutely. But doctors recommend waiting 18 to 24 months to allow complete healing of the uterus. When can you return to normal life? Driving, usually after 3 to 6 weeks. Intimacy after 6 weeks with the doctor's approval. Exercise after about 8 weeks. Daily tasks, gradually, based on recovery. Risks of C-section. Like any surgery, a C-section has risks, including infection, bleeding, blood clots, adhesions, longer recovery time compared to vaginal birth. With proper medical care, the risks are greatly reduced. Benefits of C-section. Safer option in high-risk pregnancies, avoids labor pain, allows scheduling the birth, protects the baby in certain complications. Can you have a natural birth after a C-section? Yes, in many cases. VBAC is possible if the previous incision was horizontal, there are no complications, and the pregnancy is normal. The final decision is made by the obstetrician. Essential tips for recovery. Drink plenty of water, eat fiber-rich foods, take prescribed medications. Rest as much as possible. Accept help from family members. In the end, a C-section may not be the easiest path, but it's a safe and life-saving procedure when needed. With the right care and support, recovery can be smooth and empowering. If you're preparing for birth, I hope this video has given you clarity and peace of mind. Don't forget to subscribe, like, and share this video with any expecting mother who may find it helpful. Wishing you a safe delivery, a healthy recovery, and a beautiful new beginning with your baby.